Hello, everyone. My name is Crystal Sanford, and I am the lead here at the Sanford Parents Group. And we are so excited to be here this evening. We have a really special topic for you tonight. You may be watching the video recording afterwards, so we appreciate you being here as well and hope that you find our content valuable. At the Sanford Parent Group, we empower parents around autism and IEPs. And I and my team have the pleasure of being able to support fellow families along their autism and IEP journey. I too parent a child on the autism spectrum. I'm a consultant around IEPs, a speech pathologist, but a parent first and foremost. I'm so glad tonight to have Dr. McKenna Turrill, who is here to share about vision therapy. How are you?
Hello, Crystal. Thank you so much for having me. I'm happy to be here.
Oh, thank you so much. And then I make sure because as a speech pathologist, I am a big stickler. Dr. McKenna Turrill.
Turl, you got it.
Hey,
Kind
I
of
got it
sounds like
right. Perfect.
rhymes with squirrel.
Good. Perfect. Okay, so good. So thank you for your time and being able to come and share with us about this topic. I know vision therapy is something that parents may have heard of, they may be familiar with, they may not be, but we want to bring value and give insight into this really important resource that parents can tap into.
Yes, it is excellent. So much of learning is vision related. So I'm happy to be here to share a little bit more about that resource that is available that you may not know as much about.
Oh, so good, so good. So I'll just briefly introduce Dr. McKenna Turrill. She is a dedicated optometrist in a private practice in San Diego County here. She specializes in pediatric optometry and vision therapy. Dr. Turrill fell in love with California while attending UC Berkeley School of Optometry, and she further honed her expertise through residency at Sunny College of Optometry in New York City. She provided continuing ed for fellow optometrists, and she gained valuable experience treating patients in diverse backgrounds. She is passionate about serving the community and promoting early eye care. Oh, that's so wonderful. As an infant seed provider, she's also on the board of the San Diego Center for the Blind. So many wonderful things. And then in her free time, she is a nature enthusiast and loves animals. Love that too. So Dr. McKenna, how did you fall into this field of optometry? I think it's not something that we, see a lot of, and especially maybe as females in optometry, which I think is awesome. So yeah, tell us how you found yourself in this field.
Sure. So growing up knew I wanted something in the medical profession. I loved working with people, wanting to be able to give back and provide that care.
Mhm.
But as I learned more and more, I realized I wasn't extremely interested in surgery. I liked interacting with people when they were up and awake and all of that and kind of forming a longer term relationship. So I started shadowing different professions, everything from physical therapy to optometry and optometrists, a lot of them loved what they did. They had these wonderful relationships long term with their patients. And I started to find vision, really fascinating. So, vision and how the eyes, eye muscles, brain are all connected was really interesting to me. And it was just a really nice opportunity to be able to give back and help a lot of patients.
That's so awesome. I love that. I love that you had an idea, but then you after a lot of interview and seeing and finding out that this was an area of passion for you. I think that's so similar to my story becoming a speech pathologist. I knew I wanted to work with kids in a capacity. I quickly realized I did not want to be a teacher. And so I learned about other fields that supported kids in a school environment, and speech pathology was one of them. And so that kind of led me down my path as well. What guided you as you decided optometry was the way to go? What guided you in this direction with vision therapy? Because that's really a real niche. Is that not?
It is, yeah. It's an interesting specialty and one that I myself was not familiar with, prior to optometry school. So during kind of my clinical practice and during my education, I started learning that vision was it was more than seeing 20/20. It was so much more than the clarity of our vision. So things like our eyes having to work together, having to change kind of focus from distance to near, having kind of precise eye movements, all of those things have to be correct in order for us to even read one line across the page comfortably. So these are all different systems, not just our eyes, but that are based in our brains. And I thought it was so kind of fascinating and important that these are things we could actually kind of train. So these systems we're able to train, and we can start to see improvements in them, not only in kind of our data that we gather, but really in patient symptoms. So when I started clinical work, you see patients that are having, it might be headaches, it might be double vision, it might be eye strain, it might be a child that avoids reading or has to use their finger to track, longer than they should. And being able to train these different kind of visual systems that I wasn't aware of previously, you're really able to see, either a child excel in school or someone just being able to function so much more comfortably in their typical day. So seeing kind of what vision therapy could do, I found was just really, really inspiring and really rewarding. So that's what kind of drew me to the field.
I love that, how the brain and the eyes connect, and there's so much more to seeing than 20/20. I think,
Yes.
that's so important. If parents don't leave with anything else, understand that when your child has that, annual or however often vision screening and they pass with 20/20, that's just the tip of the iceberg when it comes to learning, especially for our kids who are having difficulty as learners. There could be more going on.
Yes, exactly. Exactly. And it can be, even just a quality of life thing for a lot of people. So being able to see that improve when we're improving, aspects of the visual system is really excellent.
So good. So let's start in this conversation with a bit of an operational definition so we kind of all get on the same page. When we hear vision therapy, what does that really mean?
Yes. So I would say kind of a textbook
Mhm.
definition, more or less, of vision therapy is kind of an evidence-based treatment to help improve visual skills that are necessary for, effective learning, as well as just our daily, everyday functioning. And this could look like, and this typically looks like a, progressive program of in-office activities that works on and builds on the connection between, I like to say, our brain, our eye muscles, and our eyes to kind of build these systems so they're able to work together. And what this does is that, our goal is to improve how a patient processes and interprets visual information and making that process, effortless, essentially.
Mm,
But
effort.
yeah,
Which
yes,
probably
we try
should.
to say effortless vision. It shouldn't be something we're having to, work towards. It should be something that hopefully we can make vision and sight and comfortable reading as effortless as we can from a vision standpoint.
That's great. That's great. And I say, wow, that's really amazing. It should be effortless. This is something that shouldn't take effort and work. And like you said, kids who avoid reading, for example, because it's just too much of a strain or painful or bothersome, like there could be again something behind the scenes there.
Certainly. Yeah, especially when, they can just exactly like you said. Sometimes if there are, learning difficulties, they can, the vision can be something that's just forgotten about. So there can be undiagnosed aspects that, we can't solve everything, but it could at least improve, a portion of their reading or
Mm,
learning.
yeah, very good, very good.
Uh,
Well, I had the benefit of I have had the benefit of working in school districts for many years. And so I was aware of vision therapy. And so when my own child was struggling with reading, it's something that I had in the back of my mind. I'll just giving my own story. When we went in for her annual exam, I don't know now, maybe like 5 years ago, her optometrist said, I'm going to encourage you to share with your team some of the things that I found today, like the difficulty with tracking and just some other things that she wrote out. And she's like, you could maybe ask your team about vision therapy. So I really appreciated her sharing that because I was just like, oh, ding, ding, ding. I remember, hearing, knowing about what that was, and we were able to go through that with her, and doing her homework, and we still do that from time to time as well. We did really see some benefits. So for parents who are hearing about this today, just know that it is something that, and if it is impacting your child in their educational performance, it could be something that is investigated through the IEP process. So what kind of a child? I know my own kiddo, but you tell me, Dr. Turrill, what kind of child would likely benefit from maybe at least an assessment to see if vision therapy is appropriate?
Yeah, certainly. So there's, sometimes, teachers can catch, certain things, occupational therapists can catch things, parents can catch certain things. And sometimes this can be an eye, as obvious or not obvious as it is, an eye that wanders a little bit. So if the eyes aren't aligned properly, that can be something that's picked up, or if they're at an annual eye exam or even a pediatrician visit. If it's a noticeable eye turn, that's certainly something that we would want to evaluate for vision therapy as well. But if a child is complaining of blurry vision, if they get headaches regularly, if there's discomfort while reading, some children will be able to see, I'm seeing two of something. I'm seeing two of you, Mom. That would be an indication as well. Sometimes closing an eye, even while kind of reading, means the eyes aren't working together well. But sometimes kids also have a hard time, expressing that or telling us that. So it can be, difficulty tracking and staying within a line while we're reading, needing to use our finger more than we should. It could be just an avoidance of reading, or a very limited short attention span while reading. They're not able to tolerate it for very long. It could be poor, reading comprehension if we're having to work really hard just to kind of piece together a line or a sentence, we're not able to comprehend, our brain's already busy, we're not able to comprehend that information very well. So even poor reading comprehension, things like homework taking longer than it should, or sometimes there can be aspects of kids that are kind of overwhelmed in crowded environments. That can be a lot of things, but sometimes it can be, an aspect of the visual system and how spatially aware they are. Or if kids are clumsy and kind of bumping into things, that could be something, could be vision related, or your visual motor system. Even some things we work on are, poor handwriting. Sometimes we'll, address with occupational therapy some letter reversals, things like that. So kind of it's a wide spectrum that it would at least be worth having, an assessment for. And again, some of these referrals can just be from, your general optometrist, a pediatrician, occupational therapist, teacher, parent. We get all of those referrals.
This is really good. I think it's really great for parents to hear the variety of different aspects of how it can be impacted, because, you know, sometimes I think we're thinking of, well, if this is happening, it must be the autism, or it must be just they have a learning disability, but we often don't think about, or it could be how their vision and how they process what they see is a part of it as well. So this is really good. It's really good for parents to see that. Is there an optimal age? Let's say a parent is watching this video and they're seeing this and hearing this and thinking, oh my God, my kid is, 15. It's probably too late.
Yeah, I guess first important thing to know is it's not too late. We see, adults, we see all ages for vision therapy. A lot of adults that have eye turns, a lot of adults that have had like a traumatic brain injury. We're seeing all ages of patients for vision therapy for varying reasons. So there's no upper age limit, I would say, as far as we're able to get the most out of vision therapy. I would say when a patient is about 5 years old or so. I've had a patient as young as 3, but we're able to get more, I would say, do therapy if they're, I guess, at about the 5 or 6 developmental age level. If they're able to kind of express to me what they're seeing or read some numbers and letters, we're able to do some more activities. So that, I would say, is something to consider as well. But there are other options, which I can also talk about a little bit. If we can't do vision therapy, there are other, therapeutic actually lenses that we can use too.
Oh, okay, great. So for our younger kiddos, so I know I've seen kids who maybe, like you said, have a bit of an eye turn, or was it strombosis? No, I'm sorry.
Strabismus. Yep, I know what you mean. Yep.
Yeah.
Strabismus. Yep.
And so I've seen like there was a little boy that worked anyway, I knew and saw him often. His grandpa owned this building that I used to go to, and he had an eye patch when he was younger and different lenses. So you're saying that maybe for a younger kid there are other options to consider.
Yeah, certainly. So even if we're not able to, jump into vision therapy, it's certainly something that we can start with glasses. Sometimes patching can be indicated depending on the visual condition. But there are certainly glasses that don't just correct the vision, but can help if there's like an eye misalignment as well.
Hmm,
Mhm.
really good to know. Wonderful. Well, as we're thinking about vision therapy, it may be something that's supportive for our kids who may struggle, like you said, with tracking, maybe even with just the visual field in a lot of capacities. Maybe they receive this assessment through you. And I'm thinking, as we advocate with families, this is something we would ask for at an IEP meeting, just like we ask for any other assessment. We're asking for a vision therapy assessment. Definitely, if there is a lack of progress in reading, and also these other kinds of characteristics. And then if the team agrees and we move forward with an assessment plan, vision therapy is added, they come to you for an assessment. And then let's say in your assessment, you recommend a certain amount of hours, or how does that work?
Yeah, so we do kind of initial, vision therapy evaluation or assessment where we're kind of evaluating this different visual skills and how the child processes visual information as well. And then we're able to recommend, a certain number of sessions. And what this looks like, it's typically like a once a week in-office session. That's about 45 minutes working with either, myself in our office or a vision therapist as well, depending on kind of the developmental level of the child. If it's a kind of more advanced or more difficult, I should say, patient, I'll typically see them myself, but we also have a vision therapist that does help do kind of administer a lot of our activities. But all of the activities are planned by, myself or another optometrist in our office. So we are keeping close track of all our patients in vision therapy. And it's a weekly in-office session. And we also, like you said, what you did with your child, it sounds like we give you a little bit of homework, 10, 15 minutes a day. So not a huge time, but definitely some things to practice with at home. And we typically do after 8 or so sessions a reevaluation. So we're making sure we're kind of working towards our goals, even if we recommend, 24 to 32 sessions, for example. That is a pretty normal, I would say, pretty average number of sessions that a patient might go through. Of course, this varies depending on the severity of the eye condition, but we kind of do progress checks, so to speak, every 8 sessions to make sure we're on track and discuss, how things are looking at home with parents and teachers as well.
Mm.
This session kind of looks like, we try to keep things fun. So we have different computer games that work on our, eye teaming skills, how our eyes work together. We have different worksheets. We have devices that almost look like optical illusions that work on how, we're able to use both eyes together. We, different chart reading, lens use, some patches. So there's a lot of variation in the activities of what in a session looks like.
And then the parents carry that on at home for 15 minutes or so as well. And then you're revisiting, which is really just sounds so much like an IEP process. There's some
Yeah.
progress report check-ins there. See if we're going to be making our goals or not, making sure that things are working. I'm guessing tweaking if there's some adjustments. And then after they have finished their sessions, is there just any kind of follow-up that happens after?
Yeah, so we watch our patients pretty closely. So typically we'll say, we're going to stop our in-office. You're going to graduate from your in-office sessions, but we still have some activities for you to continue practicing at home. And then we watch, we have them back in a month for kind of a progress check. And then even 3 months just to make sure we're maintaining those skills. And each time we're saying, okay, if you were practicing 5 days a week, let's go down to 2 days a week.
Okay.
And at the 3 month mark, we might say, okay, let's just do once or twice a week for maintenance. Like you're keeping up those skills really well. If they're using any type of glasses that are kind of a therapeutic that are helping us through therapy, we might be able to reduce the prescription or reduce how often we're wearing those glasses. So there's things that we kind of slowly reduce over time while keeping a close eye, making sure they're maintaining all those skills.
This is really good for parents to know because as you are making this investment in the time and you're starting to see this progress, there is this kind of gradual release. And would you say that you find that at a certain point, kids continue to retain that growth and change that they've seen during vision therapy?
Yes, our kind of goal in therapy is to make these things muscle memory. We call it for your brain. So hopefully being when it's repetitive, that many times when we're repeating, excuse me, all of these activities, our goal is to make it muscle memory. So it's something that doesn't kind of regress over time is the goal. So, and a lot of it, some of the tracking is more almost developmental. So once we get that back up to speed, that typically stays. Some of the, whether it's eye focusing ability, keeping things clear up close and sustaining that, or some eye teaming skills, how our eyes work together, those are more likely to regress, but typically don't, especially if we're able to maintain a little bit of maintenance work at home too.
All right, so great. That's good to hear that a lot of these skills, especially with just maybe a little bit of maintenance, will retain over time. Because I know that's something the parents think about with certain kinds of therapies. It's like, is this going to retain if we stop? I mean, the same thing with other kinds of strategies or supports, right? Like it's good for in the moment, but then what happens when we stop? So sounds like that this is something that can retain and continue to cause benefit for kids.
Yes, definitely.
So good. Well, are there any myths around vision therapy, maybe that have or you've heard and you'd like to shed some light on?
Sure. As far as myths, I guess vision therapy has, in some cases been known as, a pseudoscience or that there isn't a lot of evidence around it or that it's something that's very new. But it's actually even from the 1930s or so, I think is when they started developing vision therapy. So it's actually been going on a lot longer than what even, I and a lot of people realized. And there is some, literature around, the evidence of how effective it is. And not for all conditions, but for some of the most common being one is convergence insufficiency. And all that means is that our eyes aren't able to work together very well up close or kind of tracking deficiencies as well. There's actually a lot of good evidence out there that vision therapy is a good treatment option that's really successful for these patients. We have seen it be successful with other conditions as well, but some of those still don't have all the evidence that we'd like. But it's certainly an option, for a lot of people that, is becoming more and more popular again. It was popular when it first started, kind of took a dip, and now it's more popular as a treatment option again. And there's really good evidence out there as well.
Well, I love that. And I was going to say that because you shared that at the beginning. It's an evidence-based therapy. And I love that because I think that's what the buzzword people are looking for, evidence-based practices, And so, I mean, it's good to know there. I mean, from the 30s, we're talking years ago, almost
Yes.
100 years ago, that this was developed. And so there is research around it. So parents, those who especially like me like to nerd out on the research, you can go and check it out. This is something evidence-based and can cause value for kiddos. And I would say, it's not invasive, so it doesn't hurt.
Right.
Yeah.
And sometimes we'll say, if there's a more severe eye turn or eye muscle imbalance or something like that, we'll say, you know what, we think we can help. We might not solve everything, but again, it's not invasive. It's a step that we can, take to see if there's improvement. And that's why those reevaluations are so important. We're making sure that there's progress there. And of course, if there's not, or we hit a plateau and need to switch directions in treatment, that's something that we certainly do.
That's good too. So that's really great also. So you're always checking in at these check-in points and checking progress. And so parents as well can consider if if they're seeing progress in school, if they're seeing any changes as well. So that's really great. I mean, it sounds like something that's just worth investigating for kids. And just circling back to the beginning, if there are maybe some difficulties with reading or learning or processing or even being in busy environments or when there's lots going on, kids, appearing to feel overwhelmed or reporting being overwhelmed. Or like you said, even those who have more obvious issues with like the strabismus or eyes not working as well together, it's something vision therapy worth investigating.
Yes, certainly. And I'm happy if there's, resources that I can share as well. If you'd like more resources to read up on, I'm happy to share too.
So good, because that was very, very much my next question. So if parents did have more questions about this, Dr. Turrill, where could they go? How can they connect with you if they're in the San Diego area and they want to learn more about vision therapy?
Yeah, sure. So I practice in a couple locations in the San Diego area. So in an office in La Mesa as well as up in North County. So Carlsbad as well. And I can share kind of our practice website that has some resources. And then there's also a really awesome kind of group of optometrists across the nation that there are a group of developmental kind of pediatric optometrists that focus on functional vision and vision therapy that just have awesome resources, links to, articles and studies that have been done. And I can give you that website as well if you'd like to share with parents as well, Crystal. That'd be excellent.
That would be great. Is there something quick that we can put here in the chat?
Sure. Yeah. Let's see. It is, sorry, there's a dog outside behind me.
No worries.
Okay, one is so www.covd.org.
covd.org. Okay, wonderful.
Yes, so that's an excellent resource for just everything about vision therapy, developmental optometry. There are links to different articles again, as well as there's a nice resource if you're not, in this area or, La Mesa isn't very close to you, you can kind of locate a doctor. So you can put in your zip code and you can look up, other optometrists that are part of this organization. So it's a really excellent, excellent website and resource. Let
So
me see. I can also put a link to our offices as well if you'd like to look at those.
definitely, yes. And while Dr. Turrill is doing that again, families, this is a topic that is something for us to consider as we parent kids who have special education or IEP needs, vision therapy. And so this is something that you can ask your team about vision therapy, if they can contract with a doctor like Dr. Turrill or someone in your area who could do a vision therapy evaluation. If you have some concerns and you already know, oh, wow, this is just sounding like my kid, we know they have lazy eye, or we know that they really struggle in all these environments and reading is hard. You can just simply ask your team for a vision therapy assessment and put that in writing, looking for a 15-day turnaround in a response to your team. And then your district will contract likely with an optometrist like Dr. Turrill to do this evaluation. So thank you so much for sharing beyondvisioncenter.com and La Mesa visioncare.com as well. Dr. McKenna Turrill here, our expert on vision therapy. Is there anything else you'd like to add as we wrap up today, Dr. Turrill?
I don't think so. I just know that, myself and other optometrists doing vision therapy are there to help and want to help. We participate in, IEP meetings as well. I was in one today, actually. So we're there to also try to advocate and get the best care that we can for your child and students to try to advance their learning the best we can through their vision. So we're there to help.
So good and so wonderful to have an ally who is there with bringing it this other area of specialty and expertise. So thank you so much for sharing today. And again, families, if you want more information, you can contact Dr. Turrill at lamesavisioncare.com. Also, other resources at COV as in Victor, D as in dog, COVD.org. If you need help with autism or IEPs, you always know you can reach out to us at SD, like San Diego, autismhelp.com. This is Crystal Sanford, joined by the amazing Dr. Kenneth Turrill, and we hope you have a wonderful rest of your evening. Thanks so much.
Thank you, Crystal.